really sure what I wanted to do for a backup. So I was kind of really focused on that track, and was introduced to the field of podiatry at the same time I was kind of finishing up my last year of undergrad. And I had needed to write the MCAT for podiatry school as well. So it was a bonus. I had just had to write one big, giant, expensive test instead of that and the DAT and all those other pre-admissions tests that stress you out like crazy. So I did that MCAT, and then I ended up, after doing some shadowing and spending time thinking about specialties and what I liked about specialties, I just ended up exclusively applying for podiatry school. That school was in Chicago, so it wasn't too far from home, which was nice. And then after that, most podiatry grads do anywhere from 3 to 5 years of residency after that, usually focusing on surgery. They call those PGY years, your postgraduate years. So I did a 2-year rotation at the University of Pennsylvania. It was just a really kind of neat opportunity to work with some of the editors of our surgery textbooks, which is kind of our Bible. So it was kind of a neat opportunity to be in that program. And then I did my surgical full training in rear foot reconstructive foot and ankle surgery just outside of Philadelphia. So I was in Philly for 5 years after that, and stayed in there for a year. And before I kind of settled to my first real big girl job that you're not being paid resident rates. And that was in Maryland, so just outside DC. So I was there for about 5 years. And then after that, decided to come back home to Canada. So career-wise, it was a bit of a sacrifice because our scope of podiatry in Ontario is pretty not wonderful, but it's okay. It's a better opportunity for me with family as a mom, a new mom. So it's really great to be home. And I still kind of that window open, being so close to the States. Michigan views podiatry very differently than Ontario. So, you know, it's there if I need it, but I'm actually really enjoying my practice in my life right now. And it's really nice to give back to your community and work at home, so to speak. So that kind of brings us up to now.
Awesome, thank you so much. And then we have Dr. Doko going next.
Okay, I hope you can hear me. Can someone nod? Okay. Okay. I'm Dr. Doko, family doctor here in Windsor. I've been practicing for almost 5 years now. I did my undergraduate at the University of Windsor in biochemistry, and then went to London for medical school. And actually, after 1 year of getting in, then they opened the Windsor Medical School. So that allowed me to come back and do a lot of clinical training here in Windsor, which was really nice because this is where I'm from and all my family is here. After med school, I did family medicine residency for 2 years here in Windsor. In Windsor now we have training for family medicine. If you want to be a family doctor, we have lots of great family doctors who do the training and the supervision. They also have a residency program for psychiatry now. So, and hoping to add more specialties in the future for all the you pre-meds. MCAT, I wrote the MCAT in after my second year of university, because all the science was fresh, and I studied that summer and then wrote at the end of summer. And I mean, if we can talk about questions later. I have 3 kids. I'm married. It's busy. I'm busy during the pandemic with like homeschool, and now they're back in school, working from home, working at the office. So yeah, excited to hear your questions.
Awesome, thank you so much. And then we also have Dr. Yakub.
Hi guys, my name is Elvira Yakub. I graduated medical school in 1994. I graduated overseas, so from University of Tirana. There is a 5-year medical school system where you go from high school based on certain screening parameters, and then after that you finish and you do your residency. I've been practicing in Windsor now for 19 years. That magic number 20, it's coming up. After moving to Canada, I realized that that's what I wanted to do. I just wanted to continue my effort to become a doctor. Didn't know at the time that I want to become a family doctor, but I realized that right away after I got into the International Medical Graduate Program. So when I did make it after training, so I didn't have to go for the MCATs. It was a different system. But we did compete to pass the Canadian board exams, and there you have the qualification exam, and then the qualification exam for the international medical graduate students for the Ontario. I didn't have any training back home with regards to any residency, so that was my only option really. Other candidates have other options because they have specialties or residencies back home. That year that I made it, they took 23 people from Ontario, and that took me to London, Ontario University of Western. We did a year and a half of training pre-residency. So it was like clerkship, third, fourth year of clerkship. And then I did my residency training, family medicine at London as well. After that, I moved to Windsor. My husband, at the time I was married, I'm still married. I have 3 children. My husband was living and working in Windsor at the time. So we were commuting all the time. And then after, due to personal reasons and family, I decided to move to Windsor and been here since. It was a journey to get where I am, but I'm glad I did it, and I'm glad I would make it. I would really try it again if I had to, and I don't. I enjoy it. I have no regrets. It has been hard, but it has been very rewarding in the same time. Definitely, if you have any questions about family medicine or how we're practicing, Dr. Doko, it's a little bit more up to date because she's involved a lot with the medical school, with Schulitz here in Windsor and the family medicine program. I do, though, train residents and medical students in the practice. They do either their core family medicine, or they do a clerkship a month, or if they have an elective in family medicine. And it is quite rewarding.
Awesome. Thank you all so much for sharing your journey with us. So we are going to get into questions. And then I also just wanted to let everyone know that by the end of the session, we will have time to open the floor to questions as well. So I'm just going to open up our slideshow here. So we can go in the same order as well. So we can just start with Dr. Fraser, go to Dr. Doko, and finish with Dr. Yakub for the next couple questions. So our first question to you is, what are some of the challenges and barriers that you see women facing in the medical field on a day-to-day basis? Have you ever faced these challenges personally? And if so, how did you overcome these challenges?
Well, for me personally, I didn't really, like, leading up to it, I didn't really have much insight with, you hear so much these days, I feel, about gender gap, power gap, the pink tax, all this like interesting things. And I kind of didn't really even have much of that. My dad is kind of a staunch feminist, which is really nice when you have a daughter, because you get treated like your brothers and you have to do everything. There's no princess treatment at our house, and it wasn't an option. And I think my parents kind of took that role. My mom wasn't allowed to go to university. She is a killer nurse, but she was not allowed to go to university because that was what her brother was going to do. So she had a very different upbringing. So they were very just pro, we have 2 kids and you're going to barge forward. So I didn't really pay much attention to it. But it was funny because when I was at my interview in Chicago at school, the dean was just very proud to tell me that, you know, we graduate and our incoming class is likely to have 30+% women. And I was thinking, okay, who cares? Like, oh, what's a big deal? But I kind of didn't realize until I started just being in, you know, in your different externships, during your clerkships, and your rotations through hospitals on those month-longs, when you kind of get grouped in the groups of 4 to 6, that it was either I was the only girl, the rest were guys, or there was maybe 2 of us. And I just kind of just noticed there just wasn't as many women around, especially in undergrad. We had a huge undergrad class. We started at 300 plus at Windsor. And, you know, there was, I don't know, we were just all guys and girls studying, working our hardest to get to the next step. So I didn't really notice it much until I kind of got there. And I just noticed that we weren't as present. It wasn't that equal or overwhelming. And I just kind of was always told, like, oh, do you want kids? Those were always a lot of questions I kept getting, like, do you want kids? It's going to be a challenge if you're doing medicine. And, you know, I didn't think about it. Like I said, I'm in my early 40s. I have a 20-month-old, so I'm just a new mom now. So this is kind of new to me. And I kind of because I think I was told that a lot in the beginning, I put having a family to the side until I felt like I kind of hit some of those career milestones I wanted to. So, you know, I think those just questions from other people, questions from, you know, men that I had run into in the early part of my medical training as a student and as a resident about family life, that just kind of made me feel like I had to put that on hold. That's kind of how I've dealt with them personally, but I never felt that I didn't have an opportunity when I was there. Even though we weren't as present, I didn't feel like I had less of an opportunity. That was my experience. So I didn't really feel like I had a bunch of challenges. It was just kind of for me deciding on when I was going to take some time for myself. And as I feel anybody who's very passionate about what they want to study and what they want to do, you, a lot of times, if you're very career driven, I feel like you're always going to put yourself last, except for getting to your goal. So that was kind of the biggest one for me, was about having a family and having some personal life. That was my biggest challenge.
Awesome. Thank you so much for sharing. And then we have Dr. Doko answering next.
Okay. I mean, I think maybe in the past, women had much more like barriers or challenges in a male predominant kind of job or career path. Whereas now I think actually the medical school classes are more females than males in the classes. In terms of challenges or barriers, I mean, the only thing I can think of is having children and then having to take that time off your work or your school. So when I had my first child after medical school. So I was in my family medicine training. And then I did 1 year of training, and then I had my first child. So I took a year off maternity leave. So if you're going to take maternity leave, I would say in this kind of career, you want to still make the most of it, of course, with your child, but you have to keep up to date with your medical field also. And so I did a lot of studying for my board exams for family medicine, and I completed my family medicine residency project that had to be done. So, and then coming back after being on maternity leave, I think that was a challenge because you kind of had to get back into it and you had to do a little bit reading to catch up on things. So I think that would have been maybe the biggest challenge for me as a woman. And then trying to balance then, once you have a family, trying to balance, okay, this is how much time I want to spend on work. This is how much time I want to spend with my kids, how much time I want to spend with my partner. And in the beginning, it's difficult as you're trying to, you know, start your medical career and have young children at home. So, but I think as time passes, you get the hang of it, but it is difficult in the beginning with that.
Okay, thank you so much. And then we have Dr. Yakub finishing off this question.
Yeah, I am pretty much in the same position as the previous two speakers there. I would say that I've heard more about other women's challenges that I have heard or I have experienced myself. I was lucky. I have had a very supporting family throughout my career. I had some specific personal circumstances. When I came to Canada, I had the baby first, and then I went for my exams. So I have a baby, and then when I moved to London, that was a challenge because I had an 18-month-old, and I started my third and fourth year of clerkship, I would call it, or pre-residency training, and that took like a good 18 months. And in the end of that, right when I started my residency, I got pregnant and I had my second one. And then because of that, I didn't want to delay my training. I took only a couple of months off. And then after that, as soon as I started my practice, I got pregnant again, and that was on the early 40s. So I think that that is the biggest challenge right now. I think that a word of advice would be that you're going to have to know that part of your life, part of your career will occupy a very large amount of the future years when you go in family medicine or when you go in medicine. And that will be a very fine balance. As women, I mean, our biological clock ticks with nobody to say because we were pregnant on the 40s, but, and then finding that balance, finding a partner, finding other things that you want to do in life and not necessarily get married or have children, but definitely our biological clock ticks a little bit quicker than for men. So I think that for me, I was lucky, but I think that that will be something to keep in mind. But definitely is very rewarding. There is nothing that you want really to do and you cannot do. I think I haven't had any challenges based on gender. When I got to medical school and I got to do my training, I would say that that shift happened. Used to be 20% and 80%, 20% women, 80% men in the medicine. And then that over the years shifted. And I think now we are 50-50, or women are more predominant there in the field of medicine because we're better, right? We listen better, we diagnose better, we communicate our feelings better, and then we care by nature. So I think that we are in a better position. But pretty much these have been my challenges, balancing, as Dr. Sudoko said, and Dr. Fraser said, it is all about a balance and definitely family, personal life. And you find it over time, it gets better. I've been lucky. I haven't had any big personal bias encountering during my training or after I have established my practice.
Thank you so much.
That was great. Thank you so much. And then our second question. So Many women in the medical field face the decision of having to choose between their career and being the traditional caretaker of their family. Tell us about a time when you were faced with this decision. And then all of you have kids, so I guess the second one doesn't really apply. And then we will start with Dr. Fraser again.
Okay, let me think for a second.
Yeah, for sure.
Like I said, I kind of knew the kind of mom I wanted to be. I wanted to be pretty hands-on. I was pretty sure that, well, my mom, I told you, was a nurse. She ran labor and delivery at Windsor Regional for, I don't know, 20 plus years and was always a labor and delivery nurse. So I grew up hearing about babies. You know, when everyone who has a parent that works somewhere, you kind of get that perk, whether it's at a store or at one of the big three, you get a discount on a car. Well, I had like the most awesome OB team I could ever dream of. And I was living in the States, a 15+ hour drive away from my family. And I just always kept thinking, like, how the heck am I going to do this without my mom? Like, this is like, my mom's been like, put me in, coach. She was literally at my C-section in the hallway, like, put me in, I'm coming in. She was like right there. So the fact that I've lived so far away from, I mean, I was away, I finished my undergrad in 3 years. I fast tracked. I just wanted to experience some other place besides my parents' house. So I couldn't wait to get out. So I was in the States for 15 years. And, you know, when you get wrapped up with school, as you know, even if you're at home, you're just, especially when you're on like either a pre-med or a pre-dental, pre-anything track, you're so focused on school, and your social time is limited. Your everything time is limited. So it's a bonus if you don't realize that you're living with your family, that you still get to see them, because living away for a long time, and I didn't have one of those like crazy close-knit families. We were a family of 4 and we all got along and did stuff together, and my grandparents all lived close, so we were close. But you know, when you're far away and you're limited time, and my schooling anyhow, we were kind of based off the Harvard model. It's called problem-based learning. So all the classes kind of stagger started. So we never had an overabundance of exams in 1 week. We went to school all the way around the year. And then when you start your clerkship and your externship years and you're spending your months away, you're sometimes traveling all over the country, getting different experiences in different emergency rooms, surgical programs. So I just kept thinking, you know, and throughout those years in school and residency, classmates and colleagues and even classmates' spouses were getting pregnant. And I'm like, how the heck are they doing this? Like, oh my God, I need my mom. And I really felt like that was my biggest struggle, is like, how the heck am I going to do this without my mom? And having to kind of sacrifice my scope of practice coming back here to where my parents were. And, you know, my grandmother, before she passed, she was still here. Everyone was kind of here. So I just couldn't visualize having my family be away from me. And I didn't, you know, a lot of my classmates too that weren't living near their families, they had, you know, hired help, they had nannies, you know, so that's always an option. And I think that's great. And, you know, usually in our field, like, you know, we're not the lowest on the totem pole for pay. So we can usually afford those luxuries of having, you know, more attentive care to help with those things when you're away. But family was a big part of really wanting to share that baby with. So that was my biggest thing. It was really like, do I move home and cut off my surgical career, or do I have a baby and like let somebody else do the primary caretaking? So coming home was a big decision for me, and I don't regret it at all. Like I said, having the States so close, and, you know, just what a bonus to live here. When I came home, I wasn't quite starting that family yet. I was very feeling lost, because most of my practice when I was stateside was surgical. So it was just a big shift for me. I felt like I started a whole new career. So with that, having my own practice, that gave me the control to adjust my schedule, adjust my space around nursing as long as I did, and being able to have the baby brought to me to enjoy that early bonding things that taking 6 weeks off of work wouldn't typically afford you. You couldn't work in, a finance office and necessarily have your nanny or your mom bring your baby in so you could nurse, like it was just such a luxury to me to have my mom and my family. I shouldn't say that. My dad's a huge help too, but yeah, that was the biggest part for me, was coming back home to family for support.
That was awesome. Thank you. And then we will have Dr. Doko going next.
Okay, so talking about like traditional roles, I mean, I think it's difficult when you're maybe raised by a non-working mom. Like my mom stayed at home and raised the kids. So as I grew up and then had children, I felt guilty, and that's normal to feel guilty being at work away from your kids. So after I had my first baby, I took the 1 year off, though, as Dr. Yakub also did. And my second baby and my third baby, I took much shorter times off. I think I took the year off. I was with her at home, doing all the home stuff and also doing some things in the medical field to keep up to date and with my residency and whatnot. But when I went back full time, I think, and that was because of residency. When you have your own practice, you can kind of ease back in, which is a little bit easier. But in residency, I was back, 5 or 6 days a week, full days. And I was lucky enough to have my mother-in-law come from Europe and live with us and take care of my baby and do all the cooking and cleaning. So it was like a big transition. But, that's okay. She's helping me here with my third kid too now. So family is great if you live near your family and they can help you out. If not, nannies, daycare, don't feel bad about having to use those services too if you have to. But I can tell you, as a woman and, the biology and hormones that are involved, you do feel guilty when you're away from your kids. And I think that's normal. And I think it improves with time as you kind of balance things and the kids get a little bit older. And actually, some studies have shown that it's healthy for the kids to see you working, and then a working mom, then they kind of aspire to maybe also be that. And maybe our kids won't feel so guilty about working because they saw us working. So it's a shift as time has passed. So that's my answer to that question.
Thank you so much for sharing. And then we have Dr. to going next.
Yeah, same here. It's all about the balance. It's me personally, I've been very lucky. My mom lived with me, raised my kids, helped raise my kids. And family, I remember leaving when I was on call doing my surgical rotation, and just the pager going off, and just rolling the little thing on my mom's room and say, I'm leaving right now, because she was still very little, my middle one. So it is challenging. I think that a woman that has decided to go in medicine or in any of the health-related post-grad specialities definitely has it on her to be a great mom, a good partner, a caring person, and find the balance in between your career and the family. I remember my husband bringing my third one to breastfeed her at lunchtime in my office, and then you go on with your patients again, and looking at him taking her away, as Dr. Doko said, the feeling of your hormones go crazy and oh my God, like I should be with her. But um, things do pass. I think that women are resilient, and I think that we are very resourceful as well. And I think that that makes you even a better doctor. So I think that if you take advantage, you have your family around, that's great. You leave, you don't turn your head back, you know your kid is taken care of. But there are definitely other alternatives. My friends had babies, and they just went with a daycare, and they did just fine. It has to be a little bit individualized, like everybody has their own circumstances. But in the end of the day, we all, you're gonna be okay. We all make the best and out of the circumstances. And I haven't had any friends that or any colleagues that I know, because they had to put their career on the back burner for prolonged periods of time because of wanting to be a mom. Or everybody I know has taken a little bit more time or little time based on their individual circumstances. But I don't know anybody that has actually abandoned the career or had such a prolonged period away from the career because of the family. It works out. If you are good enough to make it there, you are a wonderful person, and you are resourceful, and it's challenging at times, but is okay. In the end of the day, it works out.
Thank you so much, everyone, for sharing. And then we're going to move on to our third question. So there are often times when people are discouraged by others around them to pursue a career in medicine. Has there been a time where someone has discouraged you during your journey? And if so, how did you overcome this negativity?
Well, when I was a student in kind of late high school and into undergrad, I actually worked at the hospital as a ward clerk, a unit clerk. So the nice girl you see sitting at the desk that's pushing the papers and got the phone going, that's what I did. So I did that up in the labor and delivery unit, and I was really thinking that OBGYN was something I wanted to pursue. And the chief of OB at the time, and keep in mind, OB at that time, I'm not sure if any of you guys would remember this, Dr. Yakub might remember it if she was here. It was a really crappy time for the OBs. They were capped on how many deliveries they could do a month, and there was just a lot of negativity in that specialty. They were really struggling a lot with their malpractice coverage and kind of how their call schedule was. The call schedule here in Windsor, I think it's just Windsor. I'm not sure. Like I said, I don't live anywhere else, but in the States, it's how it used to be. You are with your doctor all the way through. So they were just really hard worked. We didn't have a ton of OBs in the town at the time. And so I was, bright eyed and watched them run around and do all these incredible things and stuff flying everywhere, C-sections, they had clinics. So I was really kind of attracted to the adrenaline that they had in their field and the hands-on clinic, hospital. It was kind of good for someone who's, wanted a lot of variety in my day. So that was kind of what drew me to that field. And it was more of a happier field as opposed to something like oncology, which can be a little more somber, a little more of a difficult field emotionally and mentally to deal with. So I remember I was getting ready to write the MCAT, and two of them, the chief and then another more senior OB, sat with me and talked to me about it. And they wanted to know what I liked, why I liked it. Why wasn't I applying for dentistry? Because they said, they're like, what you need as a good OB. And I was like, what? I was like waiting for this secret. And they both looked at me and they're like, a wife. And I'm like, oh. And they said, you are going to have a real struggle in a specialty like this or a surgical specialty and trying to have a family and find that balance. You need someone to help you with your kids. You need someone to help you with your house. And I was just kind of like, oh, I thought we were going to talk about medicine. And they kind of were just talking about balance, and which is, always been a struggle. And they had talked to me about dentistry. They talked to me about podiatry. They were talking about people they knew to go shadow in their office. So, you know, I kind of, I didn't necessarily take it as a negativity. I was trying to really heed their advice. I think, you know, them just kind of saying, we don't know how we would have done this if we would have had to be primary caregivers to our family, or interrupted our training or our education, or not be on call. And that was, you know, just kind of the first time I ever heard that. I didn't really think of it. You know, when you're a kid and you're staying up late to study till 2 a.m. anyways, because you want to kill your exam, you just kind of do it. You know, and when you're living at home and someone's feeding you and helping you out at home, you don't really have a lot of worries. So I kind of, out of respect for them, I was like, well, I'll look at some of these other fields that they mentioned and, you know, see if it's something I'm interested in. And, you know, I did obviously end up going a different route. One of the ones they had suggested, I'd never really heard much about what I do as a student. I was a dancer, so I stayed clear of any doctors, because they just would say, don't do anything for 6 weeks. And, you know, when you're a competitive athlete of any sort, you don't want to hear that. So, you know, I kind of started looking around and shadowing in offices and just kind of getting a little more visual of what their day was like, and, you know, what their lifestyle was like. And I really just started to, you know, those thoughts of what kind of life do I want? Do I want to be a family woman? Do I want to commit some time to career and then have a break? And I never really thought about it. So I took maybe them being discouraging towards like a med surge type of a specialty, and I tried to just figure out what could I choose that maybe would give me some more balance or some more control over, you know, not feeling like I couldn't have a family, because they kind of just made me feel like I couldn't have a family being a female OB, which I was kind of like, that's kind of weird because I know they exist. So that was kind of my early discouragement, and it really did kind of change my pathways. Fortunately, like I said, I was already writing the MCAT, and I had to write that for my program as well. So I didn't waste or have to pick up any other courses or classes to go that route. So yeah, I would probably recommend, if you have like an idea in your head of a specialty or a field you want to do, you know, take some time and try and shadow and try and just see what those days are like, and see what what their lifestyles are like, and ask them about their challenges and their specialties, because it honestly just wasn't something I had even considered or thought about, or probably wouldn't have thought about on my own. So as much as I think they probably weren't, I think they were obviously speaking with good intention, but they were trying to discourage me at the time. But you know, it was helpful to me. It was kind of a good critique of their field to give me. So I would say to, you know, try and you get some of that visual experience of what your life might look like in a particular specialty of medicine or health profession.
Thank you so much for sharing that story with us. So next we have Dr. Doko.
Okay. So I decided to become a doctor when I was in high school, and quite determined to do so. So I really, even if anyone was discouraging me, I really didn't hear it. I just kind of barged through and did what I had to do. I had a very supportive family, big family, busy family. So there are times when you have to advocate for yourself. You know, I come from a Albanian culture family, and we're, you know, I'm an undergrad, but expected to do certain things at family events, etc. So you just have to stick up for yourself and say, hey, I have to study. I'm going to be a doctor, and take that time for yourself and advocate for yourself.
Great, thank you. And then Dr. Yakub.
I've been lucky. I haven't really encountered any events where I was really discouraged, either that by starting medicine or practicing or even choosing my my specialty. I would say that throughout the training and the residency, there are a couple of subspecialties or like how to say rotations that you have to do that. I kind of discouraged myself, that I said, there is no way I can do it. I'm not a confrontational person in general, but for example, if you really want to do surgery, then you're going to have to see it real life. The residency is tough and lifestyle is a little bit difficult. You're going to have to just balance things a little bit different if you want to go in a surgical subspecialty. It happened that when I started my pre-residency or clerkship, my first rotation was a surgical rotation. And I would say for sure was the most difficult rotation I ever had. I was a little bit unfamiliar with the hospital system, how it works, teamwork, charting. And I mean, I was just thrown there. That kind of discouraged me from going to that subspecialty. I did well, but I still found it very stressful. Other than that, I haven't had any negativity or any discouragement really that stands out. I had a supportive family. I've been lucky with friends and the family that I was born, as well as the family that I found when I got married. They were all supportive. And without them, I wouldn't have made it. Really, nothing kind of sticks out as I said, you have to be a little bit careful with your own self, with your own experiences. And if they are hard, then don't look at them as being discouraging. Look at them as being a challenge that you can overcome and learn from. Really, as Dr. Doko said, finding that strength on yourself to say, okay, now I have to do this. I'm sorry, I can't come to this event. I can't do this. I have to study. I have to be somewhere else. That is probably the only thing that I would think as being a little bit on the side of being a challenge. But other than that, I've been lucky. And I hope everybody is in this journey.
Great, thank you all so much for sharing. So we're just going to move on to question 4, and I know Dr. Doko does have to leave at 7. So if you want to answer this one first, just so we have time to get your answer in. So have you ever, actually, I also just wanted to point out, we are going to open the door to questions from everyone in the call. So if you have any questions that you are thinking of right now, you can add it in the chat and I will read those off later. But we will ask question 4 right now. So have you ever experienced resistance from men when you are in a leadership role? What would you advise future women going into medicine to do if put in this kind of situation?
Well, I don't think I've ever experienced any resistance from men, especially in a leadership role. I mean, I was assistant director here for the program of family medicine for a year. The actual resident director was a male, Dr. Dale Zeder, and he only encouraged me to do more. Same with the dean of the medical school down here, which was a man at the time, still a man. But they were very supportive and, you know, always say, okay, what do you need? Do you need anything from us? You need any help? I don't think I ever experienced any resistance. So I don't have much to add for that. I feel maybe the tables have turned. I mean, I think there are some women that may experience some difficulties, but I have none to share right
That's a very positive answer, so thank you. And
Did you
sorry,
ask
did I
me
cut
to,
out there?
did you ask me to answer, Brian? I didn't hear.
Yes, yes,
Oh,
Dr. Fraser can go next.
okay, sorry, I didn't hear. Sorry.
That's okay, no worries.
Well, not so much. I feel like after like in school, in residency, we had a really, I mean, I had an amazing residency director. He had two daughters and a son, and all three of his kids were like pumped to kind of like following that role. And I mean, he kind of reminded me of my dad. Like, he's got three kids. He didn't define, I have daughters and a son and this and that. And so he was just super encouraging. And we just had a really strange rotation where when I was there, when I came in as a first year to that program, when I was a junior resident, there was three of us in each year, so 3 residents per year for 3 years. So there was 9 residents total in our program, and we were at a pretty like high intense academic, really high surgical volume place. So we were all running and busy. There was kind of not a lot of time for bull, so to speak. And with a great leader, I think he really set the tone. But I was chief resident in my 3rd year, and we had a sassy student south of the Mason-Dixon line. If you know anything about the states, once you start getting into those southern states, that's where I kind of feel like anybody that I kind of did experience or hear things about, they were programs in an old boys program in Georgia or down here in Arkansas. So they were very kind of like state. I started to learn a lot about American politics at this point of what red states were, and those were kind of, you meet that resistant with those types of people, so to speak. But you'll know one day when you're a student doing your rotation at somebody else's house, basically, because you're living at your hospital or you're living at the office you work at. It feels like you live there. To go in and do anything but try to know your stuff, say you'll look it up if you don't know it, have an extra pen in your pocket, have extra scissors in your pocket, whatever you could possibly need to be helpful. The bad thing to do is, especially to any women that are in the program, is to be sassy and rude and make comments. Just, it was really silly and juvenile. I kind of didn't even pick it up because the kid was just talking smoke. But I very clearly remember at the time when I was chief, there were 7 women and 2 men, and the guys in my program were awesome, like my brothers. But when we were looking at our list of who was applying and who wanted an interview to come to our program, we very quickly, like, this guy, no, bad attitude, cannot handle all the estrogen in our program, made that very clear. So he kind of lost out on even an opportunity to interview with us because we didn't want the drama and we didn't want the attitude. So I really am grateful for my residency director for being fair and not being afraid to have a heavily women-based crew. We just did our job and we got amazing training. And I didn't run into it a lot, but when we did, it was like, yeah, you're out. We just didn't have time for it. So, like Dr. Doko said, you get stronger when you're advocating for yourself. When you're an undergrad and you're not going to a party this weekend because you're going to study, then you start to just put your foot down and you're like, we're here to work, and just, you just don't tolerate that. And you just advocate for what you want your space to be like at work and what you want around you. And yeah, that was kind of very much by example led to me from my director, who was a amazing man, like I said, but he never treated us. He treated us like residents, not female, male, and whatnot. We were treated all the same. So we just didn't tolerate any of that in our space.
All right, thank you so much for sharing. I'm not sure if Dr. Doko has to leave yet, but If so, I just wanted to say thank you ahead of time for joining us. We all really appreciate you coming on this call and sharing your journey and all that good stuff. So thank you so much.
Yeah, you're welcome. If you have any specific questions for me, you can send it to the pre-med group and they can forward it to me and I'll do my best.
Yeah. All right. Thank you.
Okay, thanks. Good night, everybody.
Bye. Okay, and then we will have Dr. Yakub answer this question as well.
As the previous speaker said, nothing really that stands out. I said, I mean, you know, I've been lucky. I'm sure there is people out there that women that have encountered problems, either by colleagues that are in the same rank or somebody that it's in a higher rank or it's on a leadership position. Definitely there is people that can testify to that. I'm not. I would say that I've been lucky. My preceptor was quite supportive. When I did my family medicine rotation at one of the centralized family medicine groups, I wasn't a resident at the time. I got a highly recommended recommendation letter from my well, in the future he became my preceptor. So I was very lucky here from the beginning. I've had the support from my colleagues. Dr. Doko mentioned Dr. Dale Zeter. He's a great guy. He runs the family medicine program at Windsor. We do practice in a family health group, and we do have, I think, an equal number of male and females. Definitely there is interaction when you work in a group. We share providing urgent care for our patients, and it's 27 of us. And we have kind of supported each other. I never got that vibe of either being looked at or put down or kind of looked at differently just because I was a woman. I'm sure there are people out there that do encounter that situation. I just haven't had a personal experience. I've been lucky. There are always things that you can sense. They don't defy as being an experience per se. Sure, I mean, during the training, you can get somebody that kind of—
It's 19 hours.
Makes a comment or something that you do sense that you are probably a little bit undermined. You're going to have to stand for yourself and just put the person on its place right away, if that is possible. But and the best way to do that is with you being competent and smart. And sometimes I felt that I have to work a little bit harder to reach or get the same, I would say, a result sometimes just because you are a woman, but I wouldn't say that that was a whole experience. And I can't really give you more on that because I've had a wonderful experience. I've had colleagues and I have had friends and I have had preceptors and people that have supported, and they've been encouraging. And I think to be fair, that is going to be the general experience that you're going to have. As I said, you're going to have to be smart, and you have to work very hard, and you have to learn how to stand for yourself if that is the case.
Thank you both so much. So we're going to move on to our final question, and then we are going to open the chat for anyone that has questions for either of you. So if anyone does have questions, you can put that down in the chat. And then our final question is, from a traditional standpoint, few women are often placed in high positions in the workplace. The role of a doctor contrasts this, as it is often seen as a role of authority. Have you ever been stereotyped as a woman of authority? And if so, how did you overcome these stereotypes? And then we can start with Dr. Frazier.
Maybe I'm not understanding my question. What do you mean by woman of authority? Like as a stereotype. I'm not sure I'm not sure I understand the question.
Like if you're ever like a leader in a group where you have, I don't say underneath you, but like if you're ever in an authority position and there are men in positions underneath you, have they ever stereotyped you when you were in that position?
Aside from kind of like I said, in residency, when I was in charge, and I was in charge of it, my whole crew, not too often, like that I can think of. But like Dr. Yacoub said, your best defense, I don't even know that this is just as a woman. I feel like your best defense in any kind of situation where someone's being a jerk or a bully or trying to undermine you is competence and confidence. Knowing your stuff. I just feel like, or if you don't know your stuff, you know how to get the answer to your stuff. That's super important. I even find, I find one of the things so refreshing, and when you're working with other colleagues, when they kind of know their limitations, when they say, I'm not really sure, but I'm going to send you to this guy because this guy totally knows his stuff in that field, or I'm going to send you to this specialist, or I'm going to send you to this person to work on that injury or whatever it may be. I just feel like when you don't kind of let the arrogance be there, and you just let, being confident doesn't mean being arrogant. And I find that maybe I'm stereotyping, saying that women tend to be a little softer and can be a little nicer with things, but I try to, my back gets up, don't get me wrong, but I try to just deliver it back with, confidence, competence, and a smile. So I try not to let myself get stuck in that position. I'll speak a little off the cuff, and I hear it more from my family. I've had a lot of family members in finance, and my cousins that are female that are in finance, that when they're assertive and strong, they're looked at as a bitch. So when I read your question, that's what I'm thinking of. Like, if I've been stereotyped as like a B word because you're in charge. No, because I try to be pretty reasonable, kind of in my life in general. Like, I always will hear the other person out. I like to be at least give me your reason for why you want to do something. Doesn't mean I'm going to agree with it, but I'll try and hear you out and still make my decision, or make my my point that I need to make, or compromise, if you will. But I've not really had to deal with a lot of stereotypes in leadership roles, so to speak. Even as a speaker, I guess, is when you speak, I did a few big lectures to very big groups, and I guess that's kind of like a point role, and I didn't really have, I was always, the crowd was always gracious, men or women, with listening to you speak, because that you're kind of put as an authority position, as a teacher or a speaker, and just always been well received. So haven't had too much issue with that, thankfully.
Yes, that is good to hear. Thank you. And then we will finish off this final question with Dr. Yacoub, and then we will open the floor to questions.
Well, I'm in the same position as Dr. Fraser, really. I'm my own boss. I work. The key is to be a team member, but in the same like from the same standpoint, I am my own boss, right? I run my practice. You let your personality shine through. Some of us have a stronger personality than the others. I don't know if that is kind of may define you as a stereotype. I believe that a lot how I am and how I practice has to do with where I came from, has something to do with the culture, and has something to do with the fact that I was raised in a communist, you believe it or not, communist society. So you speak your mind, but you don't speak your mind. You don't say everything because not everything is allowed. But in the same time, you have to say the truth. You have to be compassionate. You belong to the society and you serve the society. So I think these are all good things. And culturally, we come across as being strong, and you loud, and you kind of are passionate about what you do. People read you. You can't have a poker face. So I don't know if all these might contribute to being seen or stereotyped differently, but other than that, I can't really think about anything else really. I don't have anything else to say about that.
Okay, great. Thank you so much. Those are all great answers. I really appreciate it. And then I'm just going to open up the chat right now and see what questions we have. Okay. Question from McKenna, and it is, what is the most rewarding experience you've had as a doctor? So we can start with Dr. Fraser again and then go to Dr. Yakub.
Well, I mean, being in a surgical specialty, my like most exciting thing was when I was done residency and I got to do like my first surgery, obviously by yourself with no attending. Whether the attendings were halfway paying attention in your last year or your third last year, they're kind of in and out. Like it's kind of a funny situation depending on where you're learning. But you know, it was kind of cool to go into the operating room and see your name on the board. And like this case, it's actually kind of funny because my very first day, nobody at the hospital knew me. I had only met my anesthesiologist like half hour before. And you know, you're in the operating room, everybody's in the same blue scrubs. You got your mask on, you got your hair covered, and I was early. You learn to be early at things. My first surgery was on a 26-year-old Pan Am Games champion tennis player who was like in her early 20s. So that was super stressful. But she was, you know, on track for Olympics and had this dumb break in her foot we had to fix. So no pressure. But I got there and I was super excited and I was just kind of wanting to coast through, focus. It was not a big deal to fix. I was confident and comfortable with my hands. But there was this crazy charge nurse running around who thought I was a nursing student. And she asked me if I could hurry up and mop the floor because Dr. Fraser's coming and he shouldn't be watching me mop the floor. So I was like, I can mop the floor, no problem. So I mopped the floor and the patient was coming in with the anesthesiologist on the gurney, and the anesthesiologist's eyeballs were popping out of his head. And he's like, why are you mopping the floor? And I was like, well, this nice nurse wanted me to get it done. So the room was clean. So I just did it. So, you know, part of being a good team player, I mean, this poor nurse was mortified after she told me that. And when she apologized profusely, coming from a nice, strong family of nurses, I just said to her, I'm like, honestly, I appreciate your apology, but please don't ever speak to any student, any nurse like that ever, especially in my operating room. So I kind of let her know very quickly who was the boss. So I felt very proud of myself for being able to be a team player and stand up for myself on my first day, you know, at the new school, so to speak. And thankfully the surgery went great. So it didn't kill my day. And it's kind of those silly things that just happen on a day-to-day basis that could, you know, ruffle your feathers or stress you out before you have something big to do, you know, like before your exams, before a big test, you just kind of roll with it and let it go. So like that kind of having like my first day at school, being the new kid in a new hospital, in a new state. I had moved 3 state lines, so I didn't even know where I was. So it was kind of nice to have that first day as a a practitioner in like a full on, me and my wings only, and not, not under the safety net of your attending. So that was kind of my biggest rewarding, was my first day of my big girl job.
That was a great story. Thank you so much for sharing that with us. And then we will have Dr. Youb answer, just to reiterate, what is the most rewarding experience you've had as a doctor?
This sounds a simple question, but it's a loaded question, and I'll tell you why. Every day it's a rewarding day. Unless you look at it and you feel that you're not doing the right thing. There are days where you kind of feel a little bit discouraged. Things went wrong. Somebody had a grave diagnosis. Somebody had an injury where you anticipate is going to be a very difficult recovery. Family members losing family members. And as family practice, as a family physician, you see all of it. You see it from birth to death. And in the end of the day, I think when you just kind of close your eyes before you go to bed and you kind of picture your day, I think that every day it somehow is a very rewarding experience. One time I had a professor once that said, after I did a day in family medicine, he kind of noticed the preceptor that I was a little bit off. And he said, what is that kind of bothering you today? Like, did you have an experience that it wasn't pleasant? And I did explain to him, and I told him about an encounter, and the patient have left unhappy. And he looked at me and he said, did you do the best you could for that circumstance? Do you think that you gave him the best advice you could? I said, yes. And he said, and then why is that coloring your day? I said, I don't know. I wanted him to live differently, right? And he said, so how many patients did you see today? I said, I saw, I don't know, as a resident, we used to see like 10 patients. So what about the other 9? I said, oh yeah, everything else was great. And I have this and this, and we kind of got talking, and he said, that's what you should think in the end of the day, that 9 other people left happy, that you helped them, you did the best you could, and don't let one experience that was unsatisfying or was not turned to be what you want it to be to color your day. But talking about having a reward and having experience that color your day, come in family medicine, do family medicine, all right? So you get up, you go to the office, you see the first person is a diabetic, and then you shift to the next one, and then it's a newborn, and then you shift to the next person, and it's an elderly that is 80 years old and has a lot of arthritis and a lot of pain and a lot of comorbidities and problems. And if you don't look at all that as being your best day every day, I think that probably you're not experiencing all the benefits and all the reward that medicine gives you. I can sit down and I can tell you 1,000 cases where I felt overwhelmed, and I can say, oh, that was great. But overall, the whole experience, the whole day has to be a rewarding day and a great experience. And I mean, yeah, family medicine, you see everything. I can tell you stories, but I will tell you, no day is the same, because no patient is the same. And the experience in the end of the day has to be a great one for that day. I don't know if I answered right, but that's how I look at it.
No, that was great. Thank you so much. So we Mo, and then we also had another person raising their hand in the video. So we will ask the question in the chat, and then we will go to Aya, who is raising her hand. So a question from Mo: what do you see in the future of medicine in Windsor or Ontario in general?
Well, I've been back in Windsor now for 8 years working, so a lot of things are very different. Coming from medicine in the States, I hope, and I've seen some shifting just even with different specialties, like having more integration of nurse practitioners, having more integration of physician's assistants. These were a lot of fields I didn't even know existed when I was an undergrad. So I think it's great that we have these programs that, you can learn about and explore as a student. But I'm really hoping that there's just more integration of different subspecialties and different facets of medicine into the standard, um, allopathic program. In the States, everything's very efficient. It's run as a business. Everything's very for profit, which runs very different from the non for profit. And from my understanding, most of the healthcare setup is more mimics the not for profit stuff that we have in the States. I have worked in hospitals in the States that I feel like I'm at the Ritz-Carlton. All the hospital rooms are private with like fancy carpet and like a second bed for the family. Like it's wild. It's amazing. But their healthcare system is very different over there. It's very business and service driven, which from an efficiency standpoint of having people waiting in long lines in emergency rooms and that sort of thing, I feel like the more in Windsor that we get this medical school here, these different residency programs here, you draw more attention to getting those, I guess they would be, I think it's provincial or federal dollars down the 401 to support these programs in Windsor and let that integration happen and let our Minister of Health up in Ottawa understand these different specialties and how they can be helpful. I can tell you when we went into the initial lockdown last March, I had really busted my buns when I came home. Being from Windsor was super helpful, and having my mom have like an amazing reputation at the hospital and working at the hospital myself as a student, I got to know a lot of different doctors in all sorts of specialties. And having done pre-med at Windsor, knowing a lot of colleagues whose parents were physicians and in the medical field. So I really kind of ran around and let everybody know I was here. This is what I was doing. This is what I have been doing. Kind of defending my education and my training to let people know what I was competent of, what I was capable of, what I was unfortunately not allowed to do. But, just so they understood what I could handle for them. And I have a really good handful of regularly referring doctors. We do a ton of, inpatient referral as well. But when this all started in the lockdown and we were all in emergency mode, a lot of the goal was keep these things that don't need to be in a family doctor's office, don't need to be in an urgent care clinic, don't need to be in the emergency room. And I felt like I had a lot more of the family healthcare practitioners in town reaching out and saying, hey, can we send you this injury? Hey, we have an infection on the foot. We have a diabetic with an ulcer. Can you just deal with this? Rather than having them go 3 places and end up on IV antibiotics or end up, flooding the emergency room. So it was really kind of a silver lining for me to be able to make some more connections. And I think that, it really helped facilitate different practitioners communicating with the primary care teams. And I thought it was nice because I've made some new friends in the medical community in Windsor. And I think that the more integrative and the more we use all of the resources at our fingertips, the more efficiently we can run. Because I do find that things do run so much more efficiently in the States, and dollars always make things happen faster, unfortunately. But, also having that teamwork mentality. We always worked in teams. I'm used to working in, when I was a limb salvage specialist at a wound care center, and there was 7 specialties on board. And, I had instant consults in the hallway. So those kind of team methods work well. So I really hope that, with the years to come, and like I said, getting more of these trainees and residents in town, it kind of floods our system with more educated bodies to help each other out and, work as a team and make things flow better. I don't know that it's going to do that, but that's kind of my hope for things, because I think it would be really an asset to the medical community and the community at large, just to get that healthcare experience.
Yeah. I'll just repeat the question again, since we don't have it on the screen. What do you see in the future of medicine in Windsor or Ontario in general?
If you asked me this question 10 years ago, you'd have probably gotten a different answer. We have come a long way. With regards to involving and having a team approach, as Dr. Fraser said, with regards to run multi-speciality teams in the primary care. I mean, having a nurse practitioner in our team at the family health group has helped a lot. I still believe that Windsor is overdue for a new hospital. I think that things are a little bit overcrowded in hospitals and emergency rooms. I do my best every day to keep people not going to emergency room if they don't need to go to emergency room. But as Dr. Fraser said, some things need to change. 10 years ago, we didn't, or 15 years ago, we didn't have this concept of a teamwork. And I really believe that the role of nurse practitioners, dietitian, food specialists, it's going to grow over time. I would love to see a little bit more proactive and concrete programs go into place for integrating all this knowledge. Knowledge is there. There are qualified people, more qualified people we are going to have. I think that utilizing them as it stands right now, we might not have that in order. I'm just hoping. We have come a long way. We didn't have this concept of teams years ago. Now things are growing and things are getting better. Sometimes I do feel a little bit helpless. The wait times to see a specialist or have a certain procedures are definitely longer than in the United States. I think that the accessibility to a more specialized opinion with e-consults has helped a lot. I'm hoping that we vaccinate 80% of our population, so the healthcare opens up, and we go ahead with one-to-one service, because that has been a challenge. But and innovation. I mean, look at LASIK laser surgery. I mean, Dr. Taifour, for example, was one of the pioneers, and he's still one of the best centers on his specialty in North America. So I think that trying to work the logistics of and have the infrastructure to kind of incorporate this teamwork. I think because the knowledge is there, the qualified people are there, and definitely will get better. Opening the medical school in Windsor was a big boost for this city. More and more doctors are coming to practice here. But I think that having a little bit of logistics of how this works, it is challenging, and it's going to be the biggest challenge for the future. And I hope and I think that better integration to come into place. I am not into the business part of it, but I think that the business part of medicine and how to deliver the care maybe should come a little bit more into, how to say, in the front, and work a little bit with the logistics of teamwork. We all know the wait times, we all know the consultation times, people waiting for a gallbladder surgery for months and months, and they have biliary colics and they go to emerge, and we have to tell them to go to emerge because you never know if that it's complicated and goes into cholecystitis or something more extreme. But I'm hoping that in the future we have a little bit more team approach, so the accessibility to healthcare, to a more specialized opinion, it's a little bit become better. For example, I had a person today that had a broken foot 4 weeks ago, and she had to have an open reduction internal fixation, and she has severe peripheral vascular disease, and she's diabetic. And she came today for a diabetic check, and she took her walking boot out, and I see this wound. And I said, did you show it to the orthopedic surgeon? She had an appointment with him, and she has received such a big mix of opinions of how to take care of this wound. And I said, listen, I'm not an own nurse, I'm not a specialist, a podiatrist, or I said, you know what, I think he should take a look at this, or she should take a look at this wound. And I expedited a referral, and I'm sure she will be taken care of and looked at. But things like this, I hope, and I would love to see them more accessible to patients. Having a private healthcare and business-driven and for-profit has its pros. It has a whole bunch of cons too. And I think that I would hope that the healthcare stays for nonprofit, but I think that I'm skeptical how that's going to happen. But I'm hoping that things get a little bit better with regard to accessibility to specialist and surgical procedures. I don't have the magic ball for that. I'm not good in business. I just can hope, and I can help if I'm asked. But that's what I hope and to see for Windsor, and definitely a new hospital that's way overdue, and better design and more private nursing homes. That's for sure.
Those are both amazing answers. Thank you so much. So now we have a question. Raising our hand. If you want to turn on your microphone and ask your question, you're more than welcome to.
Hi, doctors. Before I even dive into my question, thank you for coming out today and just talking to us. I think I speak on many when I say, like, it's been an incredibly welcoming and comforting experience just hearing you guys talk about everything from the start. And my question goes out to everyone, but touches upon something that Dr. Yakub actually said. But you mentioned that it's in a woman's nature to be compassionate and nurturing, and how this does make you a great doctor. But has there ever been a time where you think that makes you seem like you're taking things too personally, and then from there people don't take what you're saying as serious?
Yes. And I would say yes and no. And I will tell you, that boils down to a little bit of the role that you want to take when you enter that room and helping people. It has to be, it doesn't, like, you can't be patronizing because things don't work that way. But in the same time, you have to communicate your advice and your knowledge to the patient. So if you go too strong, then you might get a little bit of a pushback. Yes, there has been instances where you think that you might come a little bit strong, kind of communicating your advice. but have I had a pushback from somebody? And I would say it's like give and take, right? Sometimes at the best patient's interest, you might overstep a little bit and say something that would come across as being very blunt or kind of clear more than you'd like to. And sometimes at that position, you can get a pushback. You could say, okay, wait, I mean, you're saying that, but I think I know my body, right? You gave me that medication. You're telling me that it doesn't give the side effect, but I experience it. And then you sit back and you reflect on that, and definitely everything, how things going to be unfolding, it will be how you react to that. So this is an everyday experience. It just nothing stands out as being something, I would say something that stands out and is dramatic, but I think that this is a battle that you have when you interact with people, with yourself and the patient, and as long as it's productive, and as long as it's on the patient's best interest and you know your stuff, I think things work out. If I understood the question right.
You did. Thank you.
Okay.
Can you just restate your question really quickly for me again? I heard what you said, but I just want to make sure I hit the right points.
No problem. I talk fast sometimes too. My question was that like we touched upon how it's in a woman's nature to be compassionate and nurturing, and that's what makes us good doctors. But then on the other spectrum, like how does it look like when we speak from the heart? Do patients or other doctors take us less seriously?
Yeah. I don't know that I feel like I've been taken less seriously. I feel like sometimes patients will, for my type of practice anyways, in a similar way that I think with a family practice where we kind of have rotations. I'm thinking, for example, my diabetic patients that I see them on a pretty regular rotation, very similar to how family doctors do, and an acute injury that we're kind of seeing repetitively. And you get into some casual banter, and especially with like an injury or a diabetic that's pretty brittle and experiencing some significant kind of complications systemically. I feel like when you're trying to give them that compassion and hear where they're coming from and be understanding, they sometimes can blur the line between, and I feel like I didn't notice this as much with my male attendings that I did with my female attendings, because maybe we just are more compassionate as nature, but I would find that they would kind of blur that line and would, ask you some pretty personal questions. You know, um, especially I think recently to being pregnant, some of the comments that were made and things that were made, and sweet little older patients that wanted me to like bend over so they could see how my backside looked, so they could tell me if I was having a boy or a girl, and and it's just, but at the same time, when you kind of get that compassion and that trust with the patient, that's when they're going to tell you what's wrong with them, because it helps you be a better diagnostician when you have really good ears and you listen. But when you give them a little compassion and trust, they're okay to be open and tell you other symptoms and tell you other things that are going on. And you know I don't know that I've gotten, like I said, pushback, but definitely blurred of lines of professionalism. And they think they're your friend, and I mean, it's not that you're not friends with your patients, but there is that line of professionalism that needs to be maintained for perspective from a diagnosis standpoint. When you're not really paying attention, you're just chitty chatty, you don't want to miss something, you don't want to like disregard them saying they're being forgetful. I have a patient that I had seen pretty regularly. She had a couple of injuries, and she's kind of in that age range where, um, you know, she was kind of making fun of herself for tripping and falling. And she's in that age range where it just kind of clicked with me for a minute. And I'm laughing at her story and, you know, making her not feel like telling her something silly I did and I tripped the same way. And I'm always tripping and I'm falling up the stairs because I've got my phone in the laundry basket and a baby bottle and, you know, someone's calling me for food or whatever. You know, and I kind of like took a minute and I was like, okay, we need to kind of monitor this because she's in that age range where I need to worry about MS and I need to worry about, do we need to connect with her family doctor and get a neurology consult? Like, do we need to think of something else? So you kind of, on the same way with the patients getting a blurred line, you want to make sure that you're um, not hearing all of their story, you know, their personal story they're telling you, because they could be giving you symptoms and important information that you need to, you know, add to your case and add to your thought process while you're chatting. So no back of thing, but just more blurring of lines.
All right, thank you so much. So we are reaching our time. We do have one more question in the chat. Do you guys both have time to answer one last question?
Sure.
Okay, I will read it out to you. So this question is from Carolina. And she said, we talked a lot about the balance of the family/work life and how it's difficult but manageable. Do you ever find yourselves in a position wishing you chose a career where you could spend more time with your family?
Well, I can answer first since my face is giant on my screen. I'm sure.
Sure. Yeah, go ahead.
Honestly, like I said, I know I keep saying it, being a new mama and being back in Canada, I feel like I would have had a different feeling if I was in the States. So in the States, we only get 6 weeks mat leave. So nobody's, if you're like, you know, fancy and luxurious, you might stay home for 3 months. So for me, I am back in Canada now and I'm like just in awe of like our luxury of having a 12-month mat leave, especially if you're in a group and you've got some cross coverage, which is amazing. I'm in a practice where I work alone. So for me, I didn't have that opportunity, but on the same note, I was able to kind of control my day and control my space. I had an extra room, which has turned into the baby room. It's got a glider, it's got a crib, my breast pump, or you know, there's toys. It's now like looks like a little Montessori room because you know I'm just not comfortable with daycare at the moment, and I kind of can control my space. But in that early stage, my water broke. I was scheduled a C-section a week before my due date, and my water broke a week before that. And we're driving to the hospital, and we're friends with our OB, and we're texting him, and he's not getting back to us. And I'm like, oh my God, I have 4 working days before I'm supposed to be off. Like, what am I supposed to do? That's like 100 plus patients I'm not going to see. And I was losing my mind. And, you know, my my hubby's in the car with me, and he's like, you're not going to work, relax. And at that moment, I was like sitting there, like, you know, sitting on a towel, trying to like figure out how am I going to do this, texting my work wife, who's like my savior. And I'm like, help, I need you to coordinate those 4 days. And they're like, yeah, we got it. Like, no problem. But I was just sitting there thinking, I wish I had a job where I could have a 12-month mat leave and an 18-month option. Like, how amazing would that be? And it was kind of that moment I was like, what am I doing? How am I going to do this? But with your choices and with figuring out how you're going to do all these wonderful things, like stay up 100 hours in a row before you write your MCAT and then get enough sleep so that you're rested for your MCAT, you just figure it out. And it's a choice, like I said, I feel like I made early on, and I was very, you know, torn throughout my 20s and 30s. I don't think I ever had any interest in having children in my 20s. I was like in the library most of the time in my 20s. I felt like I spent a decade in the library and then in journal reviews. And, you know, in my 30s, I considered it, but I was just kind of just, I wasn't home. But that early time, I really kind of wished I had a different option. But the beauty of medicine is there are so many setups that you can place yourself in if that's something you're concerned about, that you can put yourself in that position where you've got coverage. I just didn't have coverage, so that was my biggest fear. So if you put yourself in that position where you set yourself up before you're doing something like that, you know, I wouldn't have probably had that feeling.
Great, thank you so much. And then we will finish off with Dr. Yakub, and then that'll be it for our questions.
Can I hear the question again,
Yes,
please?
absolutely. So Carolina said, we talked a lot about the balance of the family/work life and how it's difficult but manageable. Do you ever find yourself in a position wishing you chose a career where you could spend more time with your family?
Fair question. I would say that has not been the case with me. There is challenges. There are periods in life, as Dr. Fraser said, where because of the circumstances, you having a new family, a baby, things get a little bit more difficult. I wanted medicine since I was little. There are periods during your training, opening a practice that would be a little bit more challenging and difficult. I remember being pregnant at 8 weeks and doing a surgical rotation at St. Joe's in London. After a very long day and night, it was a weekend, I was about to leave. We were called in the OR again because we had urgently to do an amputation. And that was a guy that was diabetic on dialysis. And I remember the moment that I've walked on that operating room in somebody that had a gangrenous foot. And I was 8 weeks pregnant. And I thought, that is it. This is the end of my life. I don't think I can do that after 48 hours and being nauseous. And it happened that the surgeon was a Second World War veteran surgeon that worked at St. Joe's for a very long time. And the senior resident was my best friend's husband. And he must have seen behind my mask, probably I was like, God knows what color I was. And he said, Dr. such and such, I think that me and you can handle this amputation. I think we should let Dr. Yakub go home. And he said, why? What's wrong with her? And he goes, she's pregnant and she has been 48 hours on her feet and she doesn't look so good. And we don't have to deal with her here fainting. Probably we can do this on our own. And he was nice enough to let me go. But there are periods where you don't question the reasoning or the purposing of why you're doing what you're doing. But there is definitely days where you would say, heck with this, it's too much. But because you are who you are and because you're doing what you're doing, you're always going to find the strength to get back on your feet and say, no, this is just something that I can deal with, or tomorrow is gonna be a better day. I personally never questioned, irrespectively of what the circumstances was, where you definitely gonna have difficult times, days where you are discouraged, but overall, I think that, as Dr. Fraser said, if you spend 150 hours studying, and then you have to find the way to sleep so you can perform good on an exam. And you made it. I don't think that that determination will let you down. I think that that determination and that inspiration that you have to do and get where you are, I don't think you're gonna regret it. But definitely there are times where it's quite difficult. But hopefully you'll have support from family and friends as well.
Thank you both so much. I just wanted to say, hearing about your stories and your journeys, it was so insightful. And I think I can speak for everyone here that we learned a lot from you both. And we're all really thankful that you took the time to come out and speak to us tonight. So thank you so much. We really appreciate it. And yeah. And then everyone in the chat is also thanking you.
Thank you.
Thank you so much. And then everyone is free to go. We did record this, so if anyone wants to tell your friends about it or family and have people watch it, it will be available. All right, have a good night.
Thank you. Good night.
Thank you.